Have you ever felt your heart beating unusually fast, experienced shortness of breath even without exertion, or had brief dizzy spells that you quickly dismissed as stress? These could be warning signs of a much more serious condition, atrial fibrillation, AF. This is not just an irregular heartbeat, it is one of the leading causes of stroke and heart failure if left undiagnosed and untreated. Studies from the American Heart Association, AHA, reveal that millions of people worldwide are living with AF without even realizing it. Dr. Hugh Calkins, a leading electrophysiologist at Johns Hopkins Medicine, warns AF can progress silently for years, and by the time patients detect it, their hearts may already have suffered significant damage. So how dangerous is AF really? Who is at risk? And most importantly, how can you detect and manage it early? Let's explore these critical questions in detail. Atrial fibrillation, AF, is a complex and often misunderstood heart condition that affects millions worldwide. Unlike the steady, rhythmic beat of a healthy heart, AF disrupts this harmony with chaotic electrical signals originating in the upper chambers, atria. This causes the heart to beat irregularly and often much faster than normal, ranging from 100 to 175 beats per minute. Such erratic rhythms reduce the heart's efficiency, increasing the risk of complications such as stroke, heart failure, and blood clots. The American Heart Association, AHA, estimates that at least 12.1 million people in the U.S. alone will suffer from AF by 2030, highlighting the urgency of awareness and early intervention. According to Dr. Hugh Calkins, a leading electrophysiologist at Johns Hopkins Medicine, atrial fibrillation is more than just an irregular heartbeat. It significantly raises the risk of stroke and heart failure, making early detection and management essential. The heart is the core of our existence, tirelessly pumping life-sustaining blood throughout the body. When AF disrupts this process, the consequences extend far beyond the heart itself. The reduced efficiency in circulation can lead to cognitive decline, kidney dysfunction, and an increased risk of dementia, demonstrating that cardiovascular health is not isolated. It affects every organ and system within the body. A 2023 study published in the Journal of the American College of Cardiology, JACC, found that individuals with untreated AF have a twofold increased risk of developing dementia compared to those with normal heart rhythm, reinforcing the importance of proactive care. The sensation of AF can be likened to an orchestra playing out of sync where every instrument follows its own erratic tempo. While some experience noticeable symptoms, others remain unaware, allowing the condition to progress undetected. The symptoms of AF often resemble those of intense physical exertion, even when the person is at rest. Imagine sprinting for a bus and feeling your heart race uncontrollably, but now, picture that happening while sitting at your desk. Common symptoms of atrial fibrillation: heart palpitations, a rapid, fluttering heartbeat, as if your heart is skipping beats or pounding too hard. Shortness of breath, even without exertion, breathing may feel strained or difficult. Dizziness and lightheadedness, sudden sensations of imbalance, sometimes leading to fainting. Fatigue, a persistent tiredness that lingers, even after a full night's sleep. Chest discomfort, a mild sensation of pressure or pain, though not always present. Many people dismiss these signs, attributing them to stress, caffeine, aging, or exhaustion. This delay in recognition can be dangerous. AF is known to increase the risk of stroke fivefold, making early detection crucial. Beyond stroke, prolonged AF weakens the heart muscle over time, potentially leading to heart failure, where the heart can no longer effectively pump blood to meet the body's demands. Dr. Andrea Russo, former president of the Heart Rhythm Society, states, "Many patients don't realize that AF, if left untreated, can lead to irreversible heart damage. Stroke is a well-known risk, but heart failure is an equally serious consequence that often gets overlooked." John's story is a stark reminder of this reality. A 55-year-old accountant. He ignored his occasional palpitations until a sudden wave of dizziness struck him in the middle of a meeting. A medical evaluation revealed he had been living with AF for weeks, unaware of the growing risks. Risk factors that contribute to AF. AF doesn't appear in isolation. It is often linked to underlying health conditions that strain the heart. The most common risk factors include high blood pressure, hypertension, the leading cause, forcing the heart to work harder. Heart disease, coronary artery disease and heart failure heighten AF susceptibility. Obesity, extra weight increases the heart's workload. Diabetes, elevated blood sugar damages blood vessels and heart tissue. Excessive alcohol and caffeine consumption, known triggers of AF episodes. Sleep apnea, disrupts oxygen flow, affecting heart function. Sarah, a 42-year-old marathon runner, never suspected she had a heart condition. Yet, persistent palpitations led her to seek medical advice, revealing undiagnosed sleep apnea, a hidden contributor to AF. Once treated, her symptoms drastically improved. The progression of AF, a forest fire analogy. AF progresses in distinct phases, much like a forest fire. Paroxysmal AF, the small fire episodes occur sporadically, lasting minutes to days, resolving on their own or with minimal treatment. Persistent AF, the spreading fire lasts beyond 7 days and requires medical intervention. Long-standing persistent AF, the raging fire extends beyond a year, significantly affecting heart function. Permanent AF, the unstoppable inferno AF is constant, and efforts to restore normal rhythm become ineffective. The focus shifts to symptom management. Diagnosis and treatment of AF. Recognizing and diagnosing AF early is essential. The AHA recommends regular screenings for individuals over 60, particularly those with high blood pressure or a history of heart disease. Diagnostic tests include electrocardiogram. ECG measures the heart's electrical activity. Holter monitor, worn for 24 to 48 hours to capture irregularities. Echocardiogram, identifies structural heart issues. Treatment options vary based on severity and include medications, blood thinners to prevent clots, beta blockers to regulate heart rate, and antiarrhythmic drugs. Lifestyle changes, weight management, regular exercise, and stress reduction techniques like meditation. Cardioversion, a controlled electric shock to restore normal rhythm. Ablation therapy, a procedure that destroys problematic heart tissue. Pacemakers, in severe cases, devices help regulate heart rhythm. Taking control, living with AF. Living with AF requires a proactive approach. Monitor your heart rate regularly. Limit alcohol and caffeine intake. Engage in moderate, consistent exercise. Practice stress reduction techniques such as deep breathing and meditation. Follow your doctor's prescribed treatment plan. Beyond personal habits, public awareness of cardiovascular health is crucial. Heart disease remains the leading cause of death globally, and AF is a major contributor. A study in Circulation, the AHA's flagship journal, found that 1 in 3 adults with AF remain undiagnosed until they suffer a stroke or heart failure, reinforcing the need for early intervention. Tom, a 67-year-old retiree, neglected his AF symptoms until he suffered a minor stroke. Thankfully, he recovered and adopted a heart-healthy lifestyle, proving it's never too late to take control of your well-being. His case highlights the power of intervention. AF does not have to be a life sentence if managed properly. Understanding AF is the first step toward managing it effectively. By recognizing symptoms early, identifying personal risk factors, and making informed lifestyle choices, individuals can mitigate the dangers of AF and lead healthier lives. The heart is not just a pump, it is the lifeline of our existence. Prioritizing heart health means prioritizing longevity, vitality, and overall well-being. Your heart is more than just a pump, it is the rhythm of your life. A healthy heart provides energy, mental clarity, and overall well-being. However, when AF disrupts its function, it introduces a range of potential dangers. From stroke and heart failure to even fatal consequences if left unmanaged. The good news is that AF can be controlled if detected early and treated appropriately. Do not ignore even the smallest warning signs like palpitations, shortness of breath, or persistent fatigue. Ignoring them due to complacency or lack of awareness can lead to severe complications. Take action today. Heavy checkmark: monitor your heart rate regularly. Heavy checkmark: limit alcohol, caffeine, and maintain a heart-healthy diet. Heavy checkmark: engage in moderate exercise and manage stress effectively. Heavy checkmark: consult a doctor if you experience any unusual heart symptoms. If you found this article helpful, leave a like. Heavy black heart, share it with your loved ones, and comment with your thoughts. Heart health is priceless. Don't wait until it's too late.